Good morning and welcome to Inside South Florida. I'm Dave Azer. Today, do you know what to do if you've had a stroke or even how to recognize the warning signs of one? We're going to tell you. Plus, if your life needs a little more organization, it's all good. We've got a professional organizer here to keep you buttoned up. And you're going to meet a local woman who's in the running for Woman of the Year for her efforts to raise money to fight cancer. That and more as Inside South Florida starts now. Over 700,000 Americans will suffer a stroke this year, yet most of us can't identify warning signs or risk factors. Here's Dr. Nils Mueller with the Delray Medical Center with some potentially life-saving advice. Dr. Mueller, great to have you on the show. Welcome aboard.
Thank you for having me.
All right, this is a very complicated question that you spent years in medical school trying to answer, so it'd be hard to kind of break it down in 30 seconds or so, but what's a stroke?
A stroke is really the overarching term for three different conditions. The most common one is a blood clot that gets stuck in an artery in the brain. The second most common one is an artery that actually bursts in the brain and spills blood into the brain tissue. And the least common one is a ruptured brain aneurysm, and they all refer to as strokes.
And these happen fairly quickly. Take me through, in other words, the process of somebody all of a sudden feeling the symptoms and then having to be taken to the hospital.
So the most classic scenario is somebody has unrecognized irregular heartbeat, a clot forms in the fourth chamber of the heart, and then this clot at one point flips out of the heart, floats wherever it wants to float, and by accident gets stuck into a brain artery, and suddenly blood flow is cut off. The patient falls over with weakness, with speech impairment, with confusion. Those are the classic symptoms.
But how long does it take for that process to happen? Okay.
Seconds.
Right, and why does it happen?
Well, there are really three major groups again. There's 1/3 of patients that have unrecognized irregular beating hearts, and when that is the case, the clot in the heart can form and then float out of the heart and into other body tissues. The other third has a blocked artery that gradually narrows down over time, and at one point that clot can form on the surface of this, what we call plaque, the irregular artery, and shut it off or send a piece of it into the brain tissue itself. And the third one is microscopic arteries in the brain tissue itself, where a small artery in the brain gets cut off. And then obviously those are the ischemic strokes. The other ones have different etiologies.
Okay, so let's talk about some of the risk factors for people, whether it's obesity, high blood pressure. Just give me some of the big ones.
The number one risk factor is arterial hypertension or high blood pressure. About 370,000 strokes per year could be prevented. Half of the strokes could be prevented if everybody was adequately treated for the high blood pressure. And the next risk factor is diabetes, followed by high cholesterol, followed by obesity.
And is it the kind of thing where you put yourself more at risk the more obese you get? In other words, like, is someone who's exceptionally overweight at a greater risk than someone who's moderately overweight? The less you take care of yourself, the worse it
is true. So it's the same for blood pressure, diabetes, and obesity. For each 10 millimeters that your blood pressure goes up, your risk of stroke more than doubles. For diabetes, we don't really know as well a correlation, but the worse your blood sugar is controlled, the worse your risk of stroke is. The same for obesity. The more overweight you are, the higher your risk is. There's other factors that are secondarily caused, like sleep apnea gets caused by obesity, which secondarily then causes to increase the risk of stroke.
Okay, so let's talk about treatment. Let's talk about some of the things that you guys are doing at Delray Medical Center that are different from other places. So if somebody has a stroke and they come in to see you, what's the process?
So the most important part about having a stroke is that you or your family members or whoever may be your bystander recognizes that a stroke is occurring and you go to the right center. There is a limited treatment window to give clot-busting agents into the vein to allow this clot that has lodged in the brain artery to be dissolved. That has some degree of efficacy, but for bad strokes with large clots, that doesn't tend to work very well. So we have an adjunct treatment option that allows us to pull these severe clots out with a device through a catheter, through a groin puncture.
And speed is very important. I mean, just in the research that I've done reading this, everything I read was you got to treat this fast, you got to diagnose this fast. Why is speed so important?
Well, the brain tissue has a very limited amount of backup blood supply, and it really depends on what your individual plumbing, if you want to call it that, is. And there are some people that we can treat later, but the majority of brain tissue gets lost very early on. So the faster we are, the more brain tissue we can preserve. And the new imaging technologies allow us to go in and select patients that have fallen out of these time windows for whatever reason and possibly give them the chance. For instance, when they wake up with stroke symptoms, previously they were automatically disqualified for a clot-busting agent in the vein, but now we can treat them with catheter-based technology.
What is the FAST test, F-A-S-T?
FAST stands for face, arm, speech, and then time is of the essence. So what you want to do is you want to evaluate your family member or friend and look at their face and see if they have new facial drooping. You want to see if they have difficulty moving one arm versus the other, showing signs of weakness or clumsiness. And then the last one is speech. You want to have them speak a simple sentence and see if they're garbled or slurring. If you find any of those symptoms, they may be suffering a stroke and you should go to the hospital, because then time is of the essence. And so the acronym is FAST.
And then from there, you were just telling me that there's sort of a new methodology in place to get people to go to the right hospital quicker.
Right.
Yeah.
Well, there are pilot projects going on in Miami-Dade and in Western Broward where we are trying to select patients who have severe stroke based on the clinical assessment of the paramedic and routing them directly to centers that can do more than other centers can do, that can offer this catheter-based technology, which may be more effective than just clot busting in the vein alone.
So what are some of those procedures? How do you more quickly diagnose?
Those procedures are, obviously, you want to take them to a center that can do what's called perfusion scanning to see, is the brain tissue behind the clot still alive? Is it worthwhile opening the artery? And then what we can do is we can take the patients to a lab similar to a heart catheterization lab, but with two planes, and we can go in and pull the blood clot out with a special device that looks like a little wire mesh or a little chain link, and we can deploy that through the clot, open blood flow immediately, and then have it entangle in the blood clot and pull it out.
It's
those
fascinating.
are very effective treatment options, and they've really revolutionized how we treat stroke.
So if you can get to it fairly quickly and you can do some of these new treatment options, I know, I'm not sure if you like to give percentages or not, but kind of what are the percentages of a full recovery, no symptoms, no side effects?
Well, unfortunately, full recovery at this point is still more the exception than the rule. The reason for that is that our processes at this point are still too slow. It takes too long for patients to come to us. We need to have a better system of care where patients go directly to the appropriate center. If every patient would A, recognize the symptoms of stroke, and B, be at the right center at the right time, we would have vastly increased treatment options. Right now, unfortunately, I would say it's no more than 40–50% of patients that can have a near normal outcome where they go back to their previous activities.
Oh, that's kind of scary. I think about it like that. All right, so one more thing I wanted to ask you was that I guess it's becoming more prevalent in younger people now
Correct.
to be susceptible to stroke.
The reason for this development is not entirely understood. We have people who are obviously becoming more obese, and we have people who are having less access to healthcare systems to do preventive measures. But there may also be a component of hormonal therapies, contraception, smoking on the rise, these issues that are now, getting people in younger ages into the stroke age.
So then the last thing would be any advice you have for people with regards to how to take better care of themselves?
Well, ideally, you want to be on a balanced diet. You want to stay well hydrated. You want to exercise at least 30 minutes 5 times a week. And if you have typical risk factors such as high cholesterol, you want to have that checked, be on medication. If you have already had a sign of a vascular problem, being it a heart attack or a stroke, you want to have an aspirin on board, and you want to have good care from a good primary care physician.
Okay, and if people want to get a hold of you or maybe get more information, how is the best way to do that?
Well, if they want to get a hold of me, my office number is 561-499-7551, or they can call, obviously, their nearest hospital and ask for referrals.
Okay, Dr. Mueller, thanks so much for coming in. Appreciate it.
Thank you. Appreciate it.
Good to have you.
Thank you.
Thank you, Dr. Mueller. When we come back, a professional organizer can get your life and your home in tip-top shape. We're going to meet her next.